Good afternoon, everybody. My name is Professor Christine Moffatt. I'm a Professor of Skin Integrity and the Chair of the International Lymphedema Framework. And it's my great pleasure to welcome you to this Facebook Live on a very special day of the year, which is Lymphedema Awareness Day. And to be asked to talk on a subject that's very dear to my heart, which is compression and the part of self-management. Also my delight to share it with my colleague Susan Nørregaard from Denmark.
Yes, hello, my name is Susan Nørregaard and I'm a clinical specialist nurse working at the Wound Healing Center and Copenhagen Wound Healing and Lymphedema Center in Denmark. And I've been working with compression, lymphedema, wound healing for more than 30 years.
And I would really like to thank Haddenham Healthcare, our sponsor for this. Haddenham have been a tremendous support and encouragement to ILF ever since we began in 2009. And I particularly want to thank Natalie Phillips, who's also made this event possible.
And the outline of this presentation today, we know it's a big and huge topic, but we can only give you a little taste of it. So the outline today will be the current professional and patient challenges of compression, but also factors affecting self-management, and that is of course patients' belief systems, but also functional limitations that are affecting self-management, and also the psychosocial issues influencing adherence to the treatment. And then of course in the end we will also talk about the use of compression wraps in practice.
And we would love you to connect with us, so please do send us questions, post them on the video. We really need to get your interaction, and we'll do our best to answer the questions in the time that we have. So, where do I begin talking about the current challenges with compression? Compression isn't a sexy subject. It's not something that people get very excited about unless you're people like Susan and I who really know the power, the transformative power of compression therapy. But actually there's an awful lot of challenges we face at the moment, and I think these are really relevant to understand in relation to the development of new wraps that we're going to discuss today. Bandages have proven their worth over many, many decades, but there are challenges in using them. They require professional knowledge to be able to apply them effectively and safely, and if they're not, they're uncomfortable, and they can be even dangerous and cause tissue damage. And they're also very difficult to train patients and carers to apply, although of course we do that in some cases, but they're more difficult. They limit daily activities, and I have to confess, when I developed compression in the early 80s, I recommended a patient having compression applied and them leaving it on for a week. And I didn't think about the awful reality of not being able to shower, not being able to remove it and to get some relief. So these things are really, really impacting on people's lives. And we also know that we've got issues with skincare, and we want to be able to promote good skincare. And the only way to do that is to be able to have solutions that allow the products to be removed. And what can be worse for a patient or family than having odour? To be able to have families that say they can't visit relatives or they don't go out and socialise. And the quality of life literature tells us that is what happens to many of our patients. And compression hosiery, also very, very useful, very important, but also has many of its challenges. We see many, many different products in use, but we don't see professional knowledge necessarily ending up with patients getting the right type of garment, assessed in the right way and applied in the right way. And we know that there's a lot of measurement skills, particularly in people with severe lymphedema, who are mainly, for instance, made to measure garments. And the reality today in the NHS and in healthcare systems is we've got poor access to specialist services. So all of this is the backdrop to why self-management, and we call this supportive self-management. Supportive self-management has to be the future of lymphedema and leg ulcer management.
We know that compression is vital. It's the most important treatment for venous diseases. It can control the symptoms from varicose veins and post-thrombotic syndromes. It promotes and makes sure that venous leg ulcer heals, and it prevents that venous leg ulcer reoccur. But also it can reduce disorders of chronic lymphatic disorders and edema by reducing the edema and stabilization of the tissue. It can also prevent cellulitis. We know now that good compression risk reduction of 40% with good compression for cellulitis. It can also reduce symptoms in lipedema as pain and venous ulceration. Wound healing it can also give wound healing in skin grafting and pretibial laceration.
So what are the challenges, the current challenges in bandaging, particularly in the community today in the NHS? Well, actually the biggest challenge is no compression is used at all, which is, we have to remember that compression is the absolute fundamental transformative therapy. And those people who are using compression are often using low compression, which has very poor effect on stabilizing the underlying pathology, and certainly is one of the reasons why venous leg ulcers don't heal. There are problems with lack of knowledge and people not knowing how to apply different compression systems. And if they're applied in the wrong way, then of course the patients are unhappy with their experience. And clinicians are often afraid of causing some damage, that the pain associated with leg ulcers, for instance, is a sign that they shouldn't be having compression. And these assumptions are fundamentally incorrect. And then we have the problem that these patients often have a lot of exudate, they have skin problems, and the health services are so stretched that they cannot have reapplication as often as they should have. And as Susan already said in the last slide, we need to remember 38% of people with a lower leg chronic edema have cellulitis. This is a highly modifiable risk factor that compression plays a vital place in.
But it is important that we prepare the patient for compression wraps and not just deliver it. And to do that, we have to assess the patient for the best type of compression for the individual patient. And we have to understand what the previous compression treatment the patient have had. We also have to discuss the ability for the patient to apply the compression itself and to remove it and to adjust it so that the device work the best for the patient. We need to spend time teaching the application and the removal for the patient. That is vital if these bandages are going to work. And we also need to consider adjunctive therapies may be needed for the patients, and that could, for example, be antibiotics if the patient have several recurrent cellulitis.
One of the major things we're facing in this country, and in fact in the Western world, is the increase in obesity. And obesity is always a complex issue. In fact, we know that in the morbidly obese patient, those with a BMI over 50 or 60, they inevitably are going to have a lymphedema, and they're inevitably going to require compression therapy. And it's always a complex issue. And it's a complex issue because of many reasons. Their metabolic status might mean that you're concerned about the use of compression. They all have very distorted limb shape, so you're having to think about how to manage that in the patient who's obese. And of course, those patients also tend to be very immobile. They may not have good access to carers, for instance, to be able to help them. But this is a growing international issue, and I think RAPs are a really important part of addressing some of these issues. Of course, they don't change the obesity status in someone, but they give them some tools to be able to look at being able to control their edema much better. Of course, what we can't have is that everything is reliant on very specialist skills, because they are simply not available to the degree that we would like them to have. And so we actually need to have solutions that can be applied by patients and by carers. And at the same time, in a topic that's so complex, we need to understand that these patients often have multiple comorbidities. So when we're thinking about preparing a patient, we have to think about whether they have neuropathy, what is their skin condition like, can they actually manage in reality? And much of the research has shown that the morbidly obese patient has great difficulty in donning and doffing traditional compression hosiery. And the RAPs are one thing that I think can help to address this. I certainly have patients who I've taught carers, even their children, to be able to use RAPs. So what do we know about self-management and compression? Well, in reality, very little. Systematic reviews highlight the lack of evidence, but we're often very paternalistic in our attitude towards patients. So we think we know what the patient needs best, and we often don't. And guidelines in lymphedema often refer to self-management, but they don't refer to how to go about it, how to prepare a patient, and what is the best advice and the best way forward. And we need to ask the question, we don't know as yet, which patients do well and which patients perhaps would find that more difficultly.
That's why we need to educate the patient better, but to do that we need to understand that the patient understanding of compression might be impaired. It might be that the patient do not understand why they need compression. They might not understand that managing pain with compression is important for them, and we have to discuss the issues around adherence to the treatment. How can we come about this? We also need to address the limitations there is in function before and after and during the treatment, but also the lack of social support that a lot of the people or the patients need. That can be within the family, but it can also be from the government. And then we also need to address previous experiences with treatment. A lot of these patients have had several goes on different types of compression, and for some of the patients it has never worked. So this is something that we also have to address. So we simply have to design treatments in the future that addresses and reflect the patient's issues.
One of the things that perhaps I haven't got a lot of time to talk about, but is really, really important, is something called self-efficacy. This is what we call a social constructivist theory. Basically what it means is the way in which we construe our ideas about things. And self-efficacy is that really deep belief that you have that you can succeed with something. So you start your diet on the 1st of January and you believe that you will lose weight if you carry on. And so people who have a belief in their ability to do things actually do better than people who think they're going to fail. This is not going to work. But if we think this subject's complex, We have to think about the culture. We have to think about the context. We have to think about things like the resources that people have available to them, like their economic access. And we have to realise that the emotional and psychosocial status of the patient matters. If you've got someone who's got poor quality of life, depression, anxiety, it's going to affect how they approach self-management, and you need to think about that. So self-efficacy then, just to reiterate, it's based on that core belief that you can succeed with something and it will have a good effect. And it's like a bridge in people's minds. And actually clinicians need to think about these things when they're assessing patients, not just simply throw a garment or throw a new device at someone. You've got to think about how someone is going to go away and live their life and use the new interventions in a way that's helpful. So I think one of the issues that we also face is issues of definitions. We talk about the word compliance. Susan and I often talk about this issue. Compliance implies do as you're told. I go to the doctor, he tells me to do this, I do it. And of course, none of us actually follow advice in the way that we think. But actually what we really want to do is have adherence. And adherence is the ability to take that advice, to make sense of it, and to carry on with a proactive behaviour. And that's what we're looking to do. And that's also about the kind of relationships that we have with patients on an everyday basis. So I think this really shows us why innovations such as RAPS are so needed. An overburdened health service, reduction in access to professionals, lots of social pressures from both patients for increased choice and freedom. Wound and lymphedema services are often not joined up and they're under financial threat, so that's important. We've got limitations in what the current compression systems do for us, and we're ever more faced with an evidence-based culture that says, give us the evidence, not just new products, but give us the evidence. And I think what COVID taught us, which is very relevant to the issue of RAPS, is who can self-manage and who is going to struggle more. And we've learnt a lot from the COVID experience. And of course, RAPS are not new. We've actually had RAPS for well over 20 years. And we've learnt a lot in that time, and technology has dramatically changed in that time. But what we see from the evidence emerging more recently is really the power of the evidence. Because they can be adjusted, it means that we've got compression that can be more sustained in effectiveness over time. And that is one of the most important things that will lead us to have cost-effective care and the patient having a greater ability to feel in control. We've still got a long way to go, but the performance of individual RAPs is different. And so we need to look at all of the different products. And that's why we're very happy to be here looking at EasyWrap in this particular Facebook Live. I was very interested when this information was given to me before this session to see just how much we are spending. 40 million was being spent between 2022 and 23 on RAPs. And nearly 30% of the £46.8 million that the drug tariff on prescribing costs are to do with compression hosiery. This is a huge, huge area. And of course we need the evidence to keep having these products in the way that we want to have. So,
but to understand RAPs, we also have to understand what the materials are. What are the different RAPs made of? Are they elastic? Are they inelastic? How well do they perform in interface pressure? What are the stiffness in the material, and how are they constructed? And we have to understand that better, and there are different materials in different RAPs and for different patients.
And of course, we need to understand that the evidence is growing all the time. I'm Can somebody move my slide on? This seems to have stopped. The evidence is growing, and we need evidence. We need good clinical studies to prove that. But what's really important is the evidence coming out of EasyWrap in a comparison done between the different wraps. It showed that EasyWrap had really good performance. It's been very carefully designed. It's got a good ability to maintain pressure, and it's got a good high static stiffness index, and that's really, really important, and has the least variation in pressures on application. So we think this is a really very important development. So I'm excited about wraps. I want wraps to be considered, and Susan, I know you agree with me, as part of a really effective supportive self-management approach. And our experience of using wraps, from my perspective, is very positive. I think it can be used as an alternative to bandaging. It can have a very, very rapid reduction of edema because its ability to maintain pressure and to be adjusted. And it can be very helpful in self-management. We need to work much further on who is going to be most suitable, and we need to pay as much attention to that as we do to the actual device. So I'm going to hand to Susan now, because we need complex solutions, and she's going to share some more thoughts on that.
Yeah, of course, we need complex solution to complex patients. And of course, it's not always a good idea to have a wrap and say this is a wrap is the solution now to a complex issue. But it can be a part of that also, not only in day-to-day compression, but also as part of extra compression, double compression, for example, for patients who have severe edema, a chronic condition that are difficult to treat.
And Susan, we have a question in, and we've been asked, what is the best way to help introduce people to self-management with compression?
Well, for me, it depends on the patient. For me, it's a question of especially what have the patient tried before, what are the issues for this patient for the daily living, what is the best way for this patient, is there something in the daily life that makes it, for example, work or children or something that makes a wrap better than a bandage, and vice versa. So it's not there's not one thing I can say that are the best way. It's different things.
I think it's very easy when you're in a clinical environment to be in your office or in your treatment area, and you're not thinking about the whole patient.
No.
And they're there with you for maybe half an hour if you're lucky.
Yeah.
But actually they're going home and they're living their lives. And I mean, issues like hygiene, I cannot imagine being a patient being told you're not able to wash, you're not able to apply cream, you're not able to adjust. And I think those kind of issues are really, really important to them. And giving people some control, I think, is something that is really, really important. So Susan, we're asked a difficult question. How can we best manage the non-concordant patient?
Again, there is not just one solution. And again, I mean, it's a question if they are non-concordant or we just haven't introduced something or a material to them that they can use. So that, again, I mean, compression wraps, bandaging, whatever we have, stockings, it can all be a part of the tool that we offer the patients. And here wraps, of course, is maybe a solution for a non-concordant patient because they can use it for a couple of hours, then can take it off and on again, and it's easier than bandaging.
I think the whole issue again of giving people an element of control is so incredibly important. And I've been impressed when I've had patients who I've thought, gosh, is this going to work? I remember having a patient who had cerebral palsy, who was living with her small son, who was only 8 years old. And she was very severely disabled. And I wanted to use a wrap. And I was like, how is this going to work? And she said, but I have a solution. My 8-year-old can help me. Mm-hmm. And we were able to train and help that young man, help his mother apply. But I think it is about really stepping back as the clinician, isn't it? And asking ourselves, what is the real issue for a patient? Yeah. And we've also been asked whether we can use wraps if there's a leakage.
Yeah, it depends on what you put on the leakage. Yeah. If you can control that with a bandage, yeah.
I think the secret, though, is that the leakage is often solved by the wrap, because the leakage, like lymphorrhea, is happening because the compression is not adequate. But you're so right. I mean, we can use dressings underneath it, we can use secondary padding, and the wrap can be put on top. So absolutely, it can be used very much in leakage. And we've got the question, are they available on the NHS? Yes, they are. Again, you also have them in Denmark as well. I know you use them a lot. So I think that's definitely, we do. And we've had lots of international viewers. That's fantastic. I want to say hello to all of our international lymphedema frameworks in the 29 countries. So I know some of them are viewing this today. We've had viewers from Jordan, Zimbabwe. I know my colleagues from Uganda are watching, and from Saudi Arabia. So this is an international issue. And I really, it's a wonderful opportunity to come and talk about something. You know, people think compression is not interesting, but it's wonderful. It's absolutely transformative. It's a wonderful skill to have as a clinician. And I'm really, really happy to have been able to have the support of Haddon in this Facebook Live. So I'd like to thank you all very much indeed.
Thank you. Yeah.